still haven't told me what we're doing here.
Facilitating your return to the city's top cardiothoracic surgery unit?
Yes. You see, I'm not actually sure they want me.
Dr. Abood. Hi.
Shana.
Hugh, this is Dr. Abood, the new chair of the hospital.
It's an honor, Dr. Knight.
Oh, is it? Thank you.
I've been telling Farid about the great work you've been doing saving My Hope Hospital. Saving the town.
Hugh Knight, the prodigal son. No.
How are you?
Oh, much better for seeing you. Farid, a new study's about to be published indicating Dr. Knight's stent has the best long-term outcome for cardiology patients. Obviously, if we can find the funds to get Dr. Knight back on staff, it'll be a real coup for the hospital, and our patients, and our reputation.
What do you say, Hugh?
I think that sounds pretty amazing.
Great. Well, let me show you our new facilities. This way.
Nice to meet you.
The patient was a recipient of an aortic graft stent for a previous...
Just quickly, I want to introduce Dr. Hugh Knight of the Knight Cartwright stent fame.
Hello.
Back for a quick visit?
Jim, what do you got?
They've got Robert Peacock.
Cocky. Wow. What's he worth these days?
8 billion and counting.
It's looking like an MCA stroke.
History?
The patient was a recipient of an aortic graft stent for a previous type A dissection 3 years ago. I performed the surgery successfully. I didn't use your stent. I don't trust them, to be honest.
Well, if he's got an aortic stent, perhaps it's a septic embolism.
It's a stroke. And my stent is perfect. And urology have ordered 10 ectoplates to dissolve any clots.
Yeah, it does say here that he presented weeks ago with a fever.
Yeah, but the CT scans at the time showed that the graft was normal and he's been afebrile since.
Yes, that doesn't necessarily
With
mean...
all due respect, I don't need a country GP advising me, okay? And every second that passes without 10 ectoplates is endangering the patient.
Sure. Unless you're wrong. And it is an infected stent that's caused septic embolism. The tenectoplays will stop you operating in time to save him.
What's your obsession with septic emboli?
Just think it's something you should consider, that's all. Can I have a word?
Sure.
I know the Peacock of old. And he's a serious party boy. We're talking IV drug party boy. He wouldn't have shared that with admissions, which means the chance of septic embolism causing stroke-like symptoms goes up exponentially.
Get an urgent CT to rule out septic embolism before we go any further.
Okay.
Come on. Hugh.
Good surprise, huh?
Hugh. You were right about Peacock. It's a septic embolism.
Well, are you going to operate?
Just about to, but Peacock heard you were in the building and he's asking you supervise the surgery. Well, insisting, actually.
What would Jim think about that?
He's sanguine, having missed the septic emboli. We're just scrubbing for the good of the cardiothoracic unit and the patient's likely donation.
Go for it.
Sure.
Great.
Better get prepped.
Off you go. Too much?
I think I might just make a call.
So, Jim, you still got that boat?
I've got a bigger one. Much more fun.
Hope you're not compensating for anything. Shit. It's fine. It's fine. Nurse, swap and stick. Suture. Suture. Forceps.
Nurse, scissors.
Think we're ready to close up?
Good job.
Yes.
Can I start by saying thank you for all of this? And I am incredibly sorry.
It's okay. You'll be getting on that plane with Floyd tomorrow, won't you?
Yeah.
Guess you can't take the boy out of Waiho.
Shut up. I'm going to drop Floyd off to Penny. And then I'll be doing whatever it takes to make it up to you.
Really?
Really.
Say if you could secure something like the Floriade, that would be a positive benefit for the whole town. But say you're expected to oil the wheels, you know, to nudge things along a little bit. Could there ever be any situation where that might be okay?
No, that's the very thing I was sent here to stamp out.
Yeah.
Why?
I was just theorising.
Hey, can I ask you something, woman to woman?
Yes.
So Hugh has obviously had, you know, a colourful past, dating-wise.
You mean when Hugh and I were together? That was years ago.
I didn't know you and Hugh were together.
Oh, sorry. Do you mean Hugh and Penny?
Is there any woman in my hope he hasn't slept with?
I would not go digging around in that little cabbage patch if I were you. Hugh and Penny, they had an on-again, off-again thing for years.
And years.
Yeah, and then it all finished up when she got married and left town, so.
And then she came back.
She did. Anyway, I need to go fix that thing in reception, so.
Now that Hugh's leaving, I guess you'll be applying to get your old job back.
Haven't really thought that far ahead.
You're in the box seat.
My future is an open book.
Because of your marriage breakup?
Yes.
Anyway, Sydney's going to be an adventure.
Hugh's always wanted the world. I'm really pleased for both of you.
Are you?
Are we really doing the cliche where the only thing two women can find to talk about is a man?
I didn't know that's what we were doing. It's just odd. If you really were pleased for us, you wouldn't have falsified the KPI stats, you know, to keep Hugh in my hope.
That was an honest mistake.
It wasn't a deliberate one.
Look, whatever you've heard or whatever you might choose to think, I wish you and Hugh only the very best for your future happiness in Sydney. Honestly.
All good?
Yeah, just, girl talk.
I'll see you in a bit.
Hey, can we talk?
I just got to clean up my desk and say a few words to the team.
Hugh, this is everything you ever wanted. Validation, respect, recognition.
Absolutely. I'll see you in a bit.
But I had the feeling today that there was still something between you and Penny.
No, there's not.
She clearly means a lot to you.
Look, we've been a good team. That's it. We've been living out of each other's pockets for a very long time.
Sure.
Shana, I want a life with you.
Are you certain about that?
Yes. I'm sorry, I wish my life was less complicated, but it's not.
Do you want to come to Sydney because it means we'll be together, or just because you want to be a superstar surgeon in a big city?
Come on.
I'm going to Sydney today, and when you decide what you want, come and find me. Or not.
What? Shana?
Shana! Hey, stop. Will you stop, please?
This is exactly what I want. If you're going to Sydney today, then I'm coming too.
Here we go.
Here we go. Here we go. Ta-da!
Welcome to the first day of the rest of your life.
Welcome to yours.
You've got all that written down somewhere. Signatures? Because if you can make that presentation to the board, it will wheel you up in front of the master. You can get up there.
Okay, thanks.
And remember, I'm picking up at 6 for the parliamentary dinner.
Oh, shit, sorry. Totally forgot. I gotta pick Eliza up at 6 from daycare.
Okay, that's fine, but I'll have to go anyway.
Yeah, I'll get that.
Have you thought any more about an au pair?
No, not really.
You're crazy busy.
Yeah, not too busy for my daughter.
I just think an au pair would take the pressure off.
Yeah, the pressure off who?
Well, I'm not suggesting that we see Eliza any less. It's just, now that you don't have your family at your beck and call, it's different.
Thank you. Stent. 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 Stent.